Hi and welcome to this episode of Manx Radio's newscast. I'm Christy DeHaven. And during TT, we've been catching up on the breakfast show with members of our services and Manx Care to find out more about what they do and how this time of year brings different challenges to their workload. Here's a chance now to listen again to Gordon Ingram from the Great North Air Ambulance Service chatting with me on the Manx Radio Motorsport breakfast show.
Yeah, good morning. So my name is Gordon Ingram and I'm the Head of Operations and a Critical Care Paramedic for Great North Air Ambulance Service. So we are a charity based in the north of England, and we've got two bases, one over at Teesside and one at Langwathby near Penrith. And what we do is provide critical care. So we crew our aircraft with paramedics and doctors. These are experts in pre-hospital care, and a lot of them are anaesthetists or emergency medicine physicians. And we go to those patients that require that extra level of care. Ambulance service do a phenomenal job for 98% of the patients out there, but we're there for that kind of needle in a haystack of the patient who really requires the hospital being brought to them.
And we were talking yesterday, just to clear up, we were talking about the air ambulance yesterday, which is the patient transfer service within Manx Care, but you are the helicopter service essentially, aren't you?
Yeah, we are. So it's known as HEMS, so the Helicopter Emergency Medical Service. So yeah, we've kind of got two aircraft which are phenomenally quick and can get to places, on the island where the incident has happened and transport these patients to the major trauma centres at Aintree.
And that sort of sums it up really, because I guess that's when you guys are going to get called, isn't it? I mean, how is that decision made between calling the helicopter over a road ambulance?
So we've got dispatchers over at our airbase at Teesside. So the calls will come in just as they normally would, ring 999, it goes to the ambulance service here, and anything that is pertinent for us to be involved with will get contacted very quickly and make sure that our aircraft are heading this way as soon as possible.
And how many times have you been called out this TT already?
So the TT's been a little bit different. We've had the aircraft over once, I think. Yeah, so once last week, which is great, and taking that patient over to Aintree where they need to be. So Nobles kind of is there to facilitate kind of standard treatment for these patients, but a major trauma centre is where they need to be. I've been lucky to be over here and mentoring the paramedics with the island's paramedics and kind of being involved with the TT, and it's a phenomenal experience. It's amazing, and we deal with major trauma on a daily basis. To be able to assist where we can is brilliant. And
I guess something like the TT and the sort of incidents you're attending, I mean, it's quite specific care that you're having to give to these kind of the injuries, I'm guessing.
Yeah, so it's very high level. So a lot of surgical interventions, blood at the scene, anaesthetics, all these things really increase the chances of these patients surviving, and the earlier they can have those interventions, the better.
So how well equipped are you? What can you actually do on scene?
So we can provide pre-hospital anaesthetics, so just the same as if you were going to have an operation at hospital, so we can do that. We can provide surgical interventions by releasing blood or air in the chest of patients. We can give blood to patients, so if patients lose blood, the best thing to replace that with is blood. But
because we were hearing about this from Andy actually the other day. Is this the first time yesterday at the Crosby that you were actually able to use blood?
So within the TT system, yesterday was the first blood transfusion that MRMS had blood with them. So it was great, from a medical kind of conception. We had MRMS there, we had the Isle of Man Ambulance Service there, and they had myself there from GNAS. I'm working on an Isle of Man Ambulance Service car over the TT. So it's great for all of us to come together and provide that critical care that the patient needed.
Absolutely incredible. And then if they are then transferred by helicopter, what can you just sort of do within the copter itself?
So the aircraft that we have is a Dauphin aircraft. It's one of the quickest that is utilised in HEMS within Britain and the Isle of Man, and it's really good because it's very spacious. You see a lot of aircraft on TV, I'm sure, of very small helicopters. London's air ambulance is quite small because they're going into urban environments all the time. But our aircraft are quite spacious, and so we can do the essential stuff at the scene and then continue that care en route to hospital.
It must be quite difficult sometimes, location-wise. I know clearly you can get to places that road ambulances can't, but also you do have to have the right place to land, don't you?
Yeah, we do. So our pilots are phenomenal. They're all ex-military, and I wouldn't tell them that because they're not shy of telling everyone they're pilots. But no, they are brilliant, and I do laugh. But yeah, normally we can find a suitable landing site, and it's amazing these spaces that these aircraft can get into. But all I do say, if you do see an aircraft approaching and trying to land, please don't approach. Take pictures from a distance. I've landed in empty fields before and then come back with a patient. There's been hundreds of people around the aircraft. So just listen to the pilots because they'll stay with the aircraft. And
I'm intrigued by this, actually. Do you have to get permission before you land from landowners,
no,
or do you just literally go for it?
We normally, it's better to ask for forgiveness than ask for permission sometimes. So because it's a HEMS mission, a helicopter emergency medical service mission, we get put on an alpha call sign, so other aircraft within the vicinity get diverted because of us, and things like that. So we kind of have carte blanche over where we go and where we land. Obviously there are some restricted areas that we need to go around, military zones, etc. But no, we've definitely landed in some interesting places through my career. And
I'm sure nobody would be upset with you landing anyway, because obviously you're doing an incredible job. You really are. Yeah. So as we said, you were there yesterday in Crosby. So I mean, once you get there and you said you're working with all the other teams, what sort of happens between you all?
So yesterday was really interesting because I've got quite an extensive experience within pre-hospital care, but at that scene there was doctors from MRMS that I've known for many years and worked in different places throughout the UK with these doctors, and it was. And then we had Isle of Man Ambulance Service and myself, and we all just kind of came together and provided that best clinical care that patient needed. And it's amazing that you can have so many different individuals from different organisations, but we're all singing from the same hymn sheet at the end of the day, and all trying to do the best that we can for that patient.
That's fantastic to hear, and thank you for what you're doing. We've got Oliver Adver back with us again from Manx Care. Good morning, Oliver.
Morning.
How are we?
Good, thank you.
Good. And we're just hearing about, obviously, the GNAS, the Air Ambulance Service. How does that work within Manx Care then?
So GNAS is part of what we call our air bridge. So as you mentioned earlier, Christy, we have the fixed wing air ambulance, and Dr. Kate Tier was here yesterday talking about it. So the air ambulance do the vast majority of transfers from the island. They can be simple transfers, so somebody who is being transferred on a planned basis over to the UK for treatment that we can't provide. They also provide more kind of intensive care transfers. So the two transfers that went out yesterday from Aintree were both transferred out by the air ambulance team, Dr. Tier taking one of them. The casualty from Crosby, she took across to the Aintree Major Trauma Centre once they'd been stabilised on the scene, and then further stabilised and CT scanned, etc. at Nobles. But as Gordon mentioned, where HEMS comes into its own is where the helicopter can land at the roadside, deliver pre-hospital intervention, so surgery, blood, etc., and transfer the patient directly to the Aintree Major Trauma Centre or another centre that's the most appropriate. So as I say, that's GNAS is part of our air bridge. It was launched in April 2022. It was part of the Health and Care Transformation Programme, and initially funded through the Health and Care Transformation Programme. At the moment, it's funded through Manx Care, but what we hope over the next few years is that GNAS is able to raise enough money to pay for itself through charitable donations. In the UK, all of the air ambulance services are charitably funded. There's none that are funded by the NHS, and whilst the Manx Care are funding GNAS at the moment, we're hoping over the course of the next few years that donations to GNAS pick up so that it can be self-sufficient and self-funding.
So you're sort of asking the public to donate to support this as a charity. How would they do that?
I'll probably ask Gordon to answer that one, thanks.
Thanks, Oliver. Yeah, I mean, the support that we've got from Manx Care is phenomenal to provide this air bridge for the island. And within the UK, currently it costs us £28,000 every day to run our service. So it's a huge amount of money that our fundraisers need to raise. People often think that I've got the hardest job, but I definitely think they've got the hardest job. So to have the funding from Manx Care to provide that air bridge is really good. But, the more donations that we can get within GNAS, the less pressure that puts on Manx Care. So, if people want to donate, if people want to support us, you'll see adverts on buses for our air ambulance. I've been told there's a picture of my face on the side of a bus, which I'm yet to see.
That's amazing.
So I got told yesterday. But if people want to donate, then please just head to the website. It's gnas.co.uk, and please, any support that's provided is truly appreciated.
Oh, so it was a great service you provide. I suppose there are those that might say, Oliver, with such a crucial service, is it not something that Manx Care should be supporting then?
Yes, and we will continue to support it. We do have the budget for it, but clearly we're trying to try and follow the model that is in place in the UK, where HEMS are charitably funded. So and we're not, there's no rush to move over to that charitable funding model, but that's something that we really want the Isle of Man public to buy into their HEMS service, because although it's a low volume service, we're probably seeing around 20 HEMS responses per year. They do save lives, they're becoming a vital part of our health service.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you. Thank you for making it to the end of the Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.